Hi, I'm Dr. David Hill, and today we're going to talk about how to treat cold sores on babies. Now, a cold sore describes a sort of a sore or ulceration, usually around the lips. When I see these things, I'm thinking about herpes simplex virus infections. However, not all sores that you see around the mouth are herpes simplex. It's important to remember that staph and strep skin infections, impetigo, can look very similar. Sometimes your doctor can tell by looking. Sometimes we have to take a swab and send it off for viral culture, bacterial culture, or both to really know which one it is that we're treating. The herpes virus may also cause symptoms inside the mouth. Sometimes these can be really severe and really painful, interfering with eating and drinking and leading to hospitalization so the baby can have IV fluids until he or she is better. That's not common, but it does happen. Sometimes we just see a little bit of sore on the lip. Now, what does this mean about sexually transmitted herpes? What we've learned in recent years is that the same virus may cause sexually transmitted or orally transmitted herpes. So just because you have a lesion one place doesn't mean that's where it came from. Use that to be reassured. Just because the doctor says the word herpes does not mean that your baby's been molested or that you or somebody intimate to you has a herpes infection. Herpes viruses are almost ubiquitous in the human population, and there are lots and lots and lots of places to get herpes that have nothing to do with sexual contact. When we see bad recurrent herpes lesions, we can use a medication called Acyclovir. The brand name is Zovirax. To be effective, Acyclovir has to be given either orally or intravenously, depending on how common or how severe the infection is. There is one case in which case applying Zovirax ointment to the lesion helps. That's people who actually have some sort of underlying immune deficiency. But with people with an intact immune system, the Acyclovir has to be given by mouth or by IV, depending on the situation. The most dangerous type of cold sore involves the eyes and the areas around the eyes. So if you see a baby who has a cold sore at the mouth, but it also seems to be tracking up the face to the area around the eyes, that's a medical emergency and needs to be seen immediately. Talking about treating cold sores in babies, I'm Dr. David Hill.